Obesity has become one of the strongest modifiable risk factors for kidney cancer, and its impact is growing worldwide. Excess body fat, especially around the abdomen, alters the body's hormonal and metabolic environment in ways that increase strain on the kidneys. The kidneys are not only filters for blood, but also regulators of blood pressure, glucose balance, and hormone production. When fat accumulates excessively, it releases a cascade of bioactive substances, leptin, inflammatory cytokines, and insulin-like growth factors that heighten oxidative stress and create a pro-inflammatory internal state. Over time, this chronic metabolic disturbance damages kidney cells, promoting DNA mutations and encouraging the growth of abnormal tissue. Studies show that individuals with obesity have up to twice the risk of developing renal cell carcinoma compared to those with healthy weight, and this risk increases further when combined with high blood pressure or poor blood sugar control. The mechanism connecting obesity to kidney cancer is multifaceted. Elevated insulin and glucose levels stimulate pathways that drive cell proliferation, while excess adipose tissue also increases estrogen production, which may influence tumor growth in both men and women. Additionally, obesity-induced oxidative stress can harm delicate kidney structures responsible for filtering waste, causing scarring and reduced oxygen supply to tissues. This environment of low-grade inflammation and oxidative injury becomes a fertile ground for cancer initiation. Obesity also worsens hypertension, a well-established kidney cancer risk factor, and raises the workload on the kidneys, forcing them to overfilter the blood for years. This persistent stress on renal tissue gradually weakens cellular defenses and allows mutations to accumulate. However, the hopeful and empowering truth is that these same pathways can be positively influenced by diet and lifestyle. One of the most protective dietary strategies involves increasing the intake of antioxidant-rich foods, particularly berries such as blueberries, raspberries, strawberries, and blackberries. These vibrant fruits are loaded with anthocyanins, flavonoids, and vitamin C, powerful compounds that help neutralize free radicals before they can damage cellular DNA. By reducing oxidative stress and inflammation, berries act as natural shields for kidney tissues. In laboratory and clinical studies, the bioactive pigments in berries have been shown to lower markers of oxidative injury, improve vascular function, and even support better glucose regulation, all crucial for protecting kidney health. Unlike many supplements, berries provide these protective molecules in a synergistic natural form, combined with fiber and water that aid in detoxification. To integrate berries effectively into the daily diet, aim for at least 1 to 2 servings each day. Fresh or frozen berries both retain their antioxidant properties. If using frozen varieties, avoid those with added sugar or syrup. They can be blended into smoothies with yogurt or plant milk, added to oatmeal or whole grain cereal, or enjoyed as a refreshing snack between meals. The fiber in berries also helps stabilize blood sugar and support healthy weight management, an essential step in breaking the obesity cancer link. Combining berries with other plant foods rich in polyphenol, like green tea, dark leafy greens, or citrus fruits, enhances antioxidant synergy, providing broader protection for the body's filtering organs. Beyond adding berries, a comprehensive kidney protective diet should emphasize whole, unprocessed foods that minimize metabolic strain. Reducing excess sodium intake prevents high blood pressure, a major driver of kidney damage. Limiting sugary drinks and refined carbohydrates helps maintain stable insulin levels, while replacing processed meats with plant-based proteins or fish decreases the load of nitrates and advanced glycation end products, compounds that contribute to oxidative stress. Hydration plays a vital role as well. Drinking enough water throughout the day helps flush out toxins and metabolic waste, reducing the burden on the kidneys. Water infused with slices of cucumber, lemon, or berries can make hydration both refreshing and antioxidant-rich. Weight management remains a cornerstone of kidney cancer prevention. Even modest weight loss, 5 to 10% of body weight, can significantly reduce inflammation, lower blood pressure, and improve insulin sensitivity, all of which directly relieves stress on the kidneys. Regular physical activity complements dietary strategies by improving circulation and oxygen delivery to kidney tissue. Activities such as brisk walking, cycling, swimming, or even gardening performed consistently can enhance overall metabolism and reduce fat accumulation. The key is to stay active most days of the week, aiming for at least 150 minutes of moderate movement that keeps the heart and lungs working efficiently. Stress management and adequate rest are additional, often overlooked factors in kidney health. Chronic psychological stress raises cortisol levels, which can disrupt metabolism, increase fat storage, and elevate blood pressure, conditions that directly harm the kidneys over time. Incorporating relaxation practices like deep breathing, yoga, meditation, or even a short daily walk in nature can bring the body back into balance. Sufficient sleep, ideally 7 to 8 hours per night, allows the body's detoxification and repair systems to function optimally. During deep sleep, kidneys regulate fluid balance and filter waste more effectively, giving them the rest and recovery they need to stay resilient. Another important aspect of prevention is limiting exposure to environmental toxins that further burden kidney function. Avoiding excessive use of nonsteroidal anti-inflammatory drugs, NSAIDs, staying cautious with high-protein crash diets, and minimizing contact with industrial chemicals or heavy metals in workplace environments all contribute to long-term kidney protection. Supporting liver health through a diet rich in cruciferous vegetables and hydration also helps the kidneys indirectly, since the two organs work in tandem to remove waste products from the body. The warning about obesity and kidney cancer should not inspire fear, but rather awareness that small, consistent choices can profoundly influence long-term health outcomes. Every bowl of berries, every glass of water, every walk outdoors, and every night of restorative sleep strengthens the kidney's natural resilience. The kidneys are silent workers, filtering about 200 quarts of blood every day, so they require steady, gentle care rather than neglect. Obesity places invisible strain on these vital organs, but that damage can be prevented and even reversed through mindful living. By maintaining a healthy weight, nourishing the body with antioxidant-rich foods, and embracing active, balanced habits, one can drastically reduce the risk of kidney cancer and ensure that these vital organs continue their tireless work of purification and renewal throughout life. Prevention, in this case, is an everyday act of respect for the body's remarkable ability to heal, protect, and thrive when given the right support.